So my name is Priyanka. I'm from a company called Genetri Innovations, and Genetri means mother in Sanskrit, Ma. Uh, and you may guess by now that we have something to do with mothers. So Genetri is a Bangalore-based company. We started with a thought that how we can help mothers and newborns, how we can help the experts who are providing their services to mothers and newborns, and that's how we created Genetri. And our vision is to see a world where no mother and baby dies during pregnancy, childbirth, and post childbirth. How do we do that? We create medical devices, and those medical devices are supported by AI-enabled technology, the digital part of it. And those devices and the technology solution is then implemented in different healthcare settings, both government and private hospitals. So before going ahead, what do we do? I would like to take your attention on some of the stats around maternal and newborn health and why it's important to, come up with the solutions. So, there are 250,000 maternal deaths happening every year, 2 million neonatal deaths, and 80% of these deliveries, childbirth are happening, are conducted by staff nurses and midwives, especially in the low and middle income countries and low resource settings where the technology is not available, the resources are not available, healthcare staff is not available. Fetal heart rate and uterine contractions are few other parameters like maternal heart rate are important parameter to understand the distress of the baby inside, fetal distress, right? And how do we do that? We monitor these parameters during pregnancy. But unfortunately, due to multiple parameters, multiple factors, these parameters are not monitored regularly. And that's why there's a delay in providing the treatment, early initiation of treatment. So how do we solve this? How do we address this? Is by creating the ecosystem where, as I mentioned, we have the hardware, we have the devices to monitor fetal heart rate, maternal heart rate, and uterine contraction during pregnancy and intrapartum period, during the delivery period. These devices and they are now connected with a software technology where the nurse interface is there to not just, display these parameters on the tab as you can see here, but also this enables the nurses to enter the delivery related data digitally. So there's a lot of time saving because right now they maintain all the data manually on paper, which takes a lot of time, and there are multiple challenges with that data on paper. So here with the nurse interface, they can, some of the data is auto-plotted and some data they need to fill. I would like to take your attention that nurses in a typical government hospital, there's a 40 to 45 pages of long labor case sheet that they maintain for each delivery, each patient. So imagine how much time they're actually spending on, maintaining that data, and we discussed that in the morning. So we want to reduce that time so that they can invest their time in providing the treatment rather than just filling the data. And some of, majority of the time this data is actually filled retrospectively. So, Partograph, I'm not sure how many of you know Partograph, but Partograph is a tool which helps in tracking the progress of the labor. And if you can, use that tool right on time, then it can tell you what steps do you need to take, or what are the complications related with delivery. So this tool actually helps in generating the partograph automatically the moment they fill the data, and some data is automatically plotted. Then the next interface is the doctor interface, where the doctors, no matter wherever they are, they can see this data remotely, and provide the suggestions accordingly to the healthcare staff available in the healthcare facility. Imagine a government healthcare facility with multiple nurses, but no doctors available. So this can actually be a very useful tool there from that perspective. And then ultimately, this whole system is connected with a dashboard or a live monitoring, where if there are multiple patients in a hospital same time, so all the data can be displayed in one single screen with alerts generated for each patient. If there are parameters going beyond range, then the alert will be generated and nurses can go and pay attention to that particular patient. So that way it's also very time saving.
Sorry to interrupt. You have 2 minutes left.
Sure. We have different versions of the technology that we have worked on. One is based on ECG and EMG technology, where the patches stick on the belly of the mother, and it provides the continuous monitoring during the intrapartum period. Unlike the other technologies, it doesn't need to be replaced again. You don't need to locate the baby's position again and again, so that saves time. You can see it here like that, and then it is connected with a software technology. It can also be connected to a phone, mobile application. Then another tool is based on the traditional cardiotocography principle, where the fetal Doppler helps with fetal heart rate and toco is for uterine contraction. Again, these two devices are connected with the software application. This is how it is applied. These are different offerings. I'll not go into the detail, but depending on what kind of features they want in the technology. That's how the graph would look like on the software. And this is how the interpretation is also done, because the complicated graphs are not always easy for nurses and midwives to understand. So that's why the interpretation is also for them to understand. The dashboard that I was talking about. This is our team. We are a team of 45 members. We were in Shark Tank last year. We got the deal from Namita Thapar as well. The technology is based by multiple clinical studies. We have around 6 clinical studies.
Your time's up, Priyanka.
Just one second. And we are currently, we have deployed solutions in 6 to 7 state governments, supported by different foundations working in public health and private healthcare sector. Thank you so much.
Thank you, wonderful presentation. I'm just going to ask some basic questions. So are you, do you have revenues coming into the thing at this point in time?
Yes, we have revenues. We started the commercialization of the devices in 2021, and the total revenue is around 3 CR.
Sorry, great product. What is the kind of revenue model? Is it selling the device or a SaaS model or a paper use, or how is it built?
It's a subscription based model.
How long is the subscription and how much you charge per month or per week?
So there's a one-time capital cost, devices cost, and then for software usage, annual subscription is there for around, and again depending on the kind of software version they are taking, but from 9 to 15,000 there's an annual per device cost.
Okay, so what are the certifications? We already gone through the medical grade certificates like CE or FDA or Sodasco and all that?
Yes, so the Doppler and Toco technology is a CE certified technology, and we are in the process of getting the FDA process started.
So far you are implemented only in India or elsewhere?
It's also available outside India. So we have recently implemented a project with government of Sierra Leone and a foundation called Partners in Health. So we are working there in 10 healthcare facilities right now.
Do you have any statistics on some kind of reduction in mortality rate? Because I saw the data. So with your device, is there any reduction in mortality rate? Do you have some stats?
It's very difficult to understand that sort of a model as of now because there are multiple confounding factors, right? But I can say that definitely there has been an observation in saving the time of the nurses and midwives who were earlier busy in maintaining this data on paper. And also there's, because the device generates alert, so, they can quickly pay attention to the patients for whom the alerts are generated. For example, for a baby, fetal heart rate is low for some time, then they go and check that patient and ask patient to move so that if there is any change with the movement in the fetal heart rate. If not, then they escalate the process as per the standard protocol.
Thank you. That was a very precise presentation. I'm a doctor. I'm not a technologist. You showed me numbers earlier, that is MMR and IMR rate. But just to continue his question, how do you think you're going to reduce this IMR and MMRs? Because where is it going to be placed? Is it in rural areas or urban areas? And what kind of access do they have for higher medical facilities? You said it reduces the nursing time, that's fine. But how is it going to translate into reduction of IMRs and MMRs? Because most of these can be prevented even on the antenatal care itself, identifying the high-risk pregnancies earlier on. Because you are, say, 100 miles away from a tertiary care center, you better ship them on to the tertiary care center rather than keeping them in the remote center with all these gadgets.
So, we understood that fact as well, that if you want to reduce MMR, you actually need to start from antenatal period. And we've started offering the NST care in community and home level so that the care, complication can be identified early on. And in fact, we have recently launched the device usage during transportation in rural healthcare facilities. Recently, we have done that trial in Bihar in Purnia district, where we wanted to see how useful the devices will be in generating alert during the transportation, and then that patient can directly be transferred to a higher level of facility rather than being transferred to a primary healthcare facility. So I think to answer your question, yes, we are in the process of understanding ourselves that what model do we need to, or what kind of studies or pilot we need to do to understand the impact on maternal and newborn death rate.
I have 3 questions. First, the promoters, what's their qualifications?
So the founder is a biotech engineer, and we have around 10 to 12 medical advisors who are the gynecologists and expert in the medical field.
Second thing is, who are your competitors in this product? Is there anybody else who has a similar product?
Yes, there are. So there are multiple competitors who are working on the patch-based technology, the EMG, ECG and EMG technology. There's a product by GE. I think Inaxel is another company who has a similar product. Yeah.
And do you compete with them on price or on efficiency?
I think we're trying on both price and efficiency as well.
Do you have any idea how much would you be 50% of that cost, 30% of that cost, 100% of that cost? Where do you?
I think that again depends on the kind of model, but yeah.
Let's take a bulge bracket person like GE. Compared to their equipment, how much cheaper or costlier would you be?
I think 50 to 60% cheaper, yes.
What's your current capital, equity and debt?
So the total money that we have raised so far is around 16 CR.
Is equity plus pref?
Yes.
Equity like?
Yes.
Okay, no debt.
Sorry?
No bank loan or anything like that?
No bank loan. So this is from grant and equity.
Are you looking for any capital?
Yes.
How much and why?
For that question, I'll have to check with the founder.
Fine. Thank you.
Thank you so much.